This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. Mental retardation is a congenital disability that is irreversible, and patients display slower learning and poor motor skills when compared to normal children of the same age and generally show a lower intellectual level. This paper examines important issues related to mental retardation. What is mental retardation? Nichols has argued that the term mentally retarded has acquired a shameful and often derogatory synonym by teachers, parents, and the general public, and a mentally retarded person is regarded with scorn, discriminated, and often denied basic dignities in life. In the United States, this term is called development delay and gives the impression that the afflicted person has a temporary dysfunction, and with the passage of time, the abnormal behavior may go away. Other terms that are used include development disability and intellectual disability. While development disability refers to delay in growth or onset of puberty, it is used to refer to psychiatric or physical delay. The term intellectual disability is used to denote people who display a far lesser intellectual quotient. The psychologist Henry Goddard stated that the mentally retarded person was an adult with the intellectual ability of a 5-year-old child. The American Association on Intellectual and Developmental Disabilities defines mental retardation as significantly subaverage general intellectual functioning, existing concurrently with deficits in adaptive behavior and manifested during the developmental period, that adversely affects a child's educational performance. Mental retardation is used to denote a person who has limitations in functioning mentally and has problems with basic skills such as communication, maintaining personal hygiene, and lacks social skills. The child will consequently develop more slowly than other children of the same age. As a baby and during the growing up years, the child will take a longer time to crawl, walk, talk, and have more trouble while eating. As the child grows up, the child has problems in school in keeping up with the studies and playing sports. Causes of mental retardation. Mental retardation is not the same as autism, Asperger syndrome, or Down syndrome and is not the same as mental illness or psychiatric cases. Vandershe suggests that the reason for mental retardation could be due to pregnancy problems. Mental retardation can occur when the fetus inside the womb does not develop properly. If the expecting mother is a drug addict, is an alcoholic, or gets infections such as rubella, then the baby can be born with mental retardation. In some cases, during childbirth, if the baby does not get enough oxygen, then this problem can arise. Forceps delivery of babies that have a breech delivery can damage the skull and can cause mental retardation. Inherited defective genes. Families that have married close relations for a few generations show inbreeding, which is a type of mental retardation. In some cases, abnormal gene mutation, defective cell division, and inherited genetic conditions can cause such problems. Poisoning and infections at an early age. Small children who are inflicted with diseases such as meningitis, whooping cough, poisoning due to mercury and lead, and if the child is not given good care, then mental retardation can occur. Iodine deficiency. Pregnant women who have iodine deficiency or children with iodine deficiency can give birth to mentally retarded children. This disease is present in certain developing countries. Isolation and imprisonment. Some cases of children who have been imprisoned in dark, cramped places for a long time have shown mental retardation. Diagnosis and identification. Lustig has suggested a few measures that could help in the early identification and diagnosis of mental retardation. He has also suggested a range of IQ values that denote the amount of retardation in the child. The author suggests that early diagnosis is very important since it gives enough time for the child to be treated and provides the means to find a job and lead an independent life. The author also argued that the many cases of mentally retarded patients who turn to violence, unsocial activity, and even murder are actually cases where the ailment was not diagnosed early in life, and the child was being lazy, not hardworking, and so on, when actually the child was a slow learner. The author has pointed out that throughout the ages, terms such as imbecile, cretin, idiot, moron, and others have been used. CDC, Center for Disease Control and Prevention, has listed the symptoms for early detection of mental retardation. If the child has trouble or starts very late in movements, such as sitting up, crawling, or walking later than normal children. If the child begins to learn how to talk very late or has excessive trouble learning a few words and repeating them. If the child finds it difficult to remember simple things. If the child does not show an understanding of social rules. If the child has trouble seeing what happens when they do something. In preschool, if the child has difficulties in learning and has trouble in solving problems such as recognizing shapes and colors. How the law treats mentally retarded convicts. Pelka has collected evidence of more than 100 cases where mentally retarded patients have been convicted of felony and murder. He has argued that the police have, in many cases, first wrongly arrested the mentally retarded patient, forced them to waive their right to remain silent and the right to have an attorney present, and forced the person to sign a confession using coercion, and this confession has been accepted by the jury. The author has pointed out that public prosecutors and ambitious police officers who want a successful conviction in their records often force the victim in trials to make damning admissions by offering suggestions and asking them to admit to a crime. The author suggests that the traumatized patient, who is desperate to make people happy, admits to crimes and is convicted. The author has pointed out that the judicial officers do not have an understanding of mental retardation and associate this illness with patients suffering from Down syndrome. Many patients almost look and speak like normal beings, and this leads to their conviction. Did you like this introduction to mental retardation sample? To get more works like this one, make sure to check out the database of academic paper examples at ivpanda.com. You will find thousands of samples for all your study needs.